The classic definition of endodontic success goes back 5 decades, as these two quotes from research in the 1970s demonstrate. Quote, "The case in which the periapical bone structure in the periodontal membrane appeared normal on the roentgenogram and the tooth was entirely comfortable. A case was judged unsuccessful if an area of rarefaction had developed where none had existed before, if a previous area of refraction had not repaired, or if on checkup the tooth was sensitive to percussion or was uncomfortable." End quote. The source for this is M. Goldman et al., Reliability of Radiographic Interpretations, Oral Surgery, Oral Medicine, Oral Pathology, 1974. Quote, "It is clear that the radiograph is a very questionable means of determining success and failure. This is not surprising, for we reinterpret radiographs. We do not read them." End quote. Source for this again is M. Goldman et al., Endodontic Success, Who's Reading the Radiograph, Oral Surgery, Oral Medicine, Oral Pathology, 1972. There is a vast amount of literature on the meaning of radiographic interpretation of endodontic treatments. The reliability of radiographs to prove success is always in doubt. For example, in an autopsy study that examined block sections of 29 root-treated teeth, 10 had radiographic rarefactions and histologically verified periapically. Of the 19 that were radiographically normal, 5 had periapical inflammation when examined histologically. The source for this is Green T.L. et al., Radiographic and Histologic Periapical Findings of Root Canal-Treated Teeth in a Cadaver, Oral Surgery, Oral Medicine, Oral Pathology, Oral Radiology, and Endodontology, 1997. Cone beam computed tomography systems, or CBCT, offers a new level of seeing beyond just the X-ray and getting to the root of dental conditions. For example, in 2014, researchers explained, quote, "CBCT imaging appears to provide a superior validity and reliability in the detection of periapical lesions." End quote. Source for this is T. Vence Kutonis et al., The Importance of Cone Beam Computed Tomography in the Management of Endodontic Problems, a review of the literature, Journal of Endodontics, 2014. As another example, we will share the following photos provided by Steve Correll from a case of an endodontic treatment that would have been acceptable until the CBCT reveals the extent of its failure. This X-ray shows an upper left second molar at a PA, preparatory appointment, at the time of treatment. This X-ray from a follow-up PA 18 months later shows a reasonable degree of healing. However, this CBCT scan taken the same day, rotated into the coronal phase, shows how the healing was illusory. Yet the tooth was entirely comfortable. Is it a treatment failure? And what exactly is in those roots? Beyond massive numbers of anecdotes and the percentage of teeth that smell bad when extracted, evidence for the toxicity of root canal treatments is sparsely documented. The best recorded phenomenon is the ability of dilute extracts from the surface of extracted treated roots to inhibit critical enzymes. This has been explained in an article titled "In Vitro Enzymatic Inhibition Associated with Asymptomatic Root Canal Treated Teeth, Results from a Sample of 25 Extracted Root Fragments" by IAOMT's Dr. Stuart Nunley. In this research, Dr. Nunley tested 6 enzymes that are critically important for human life to determine their percent inhibition when exposed to root fragments of 25 extracted root canal treated teeth. The results were that the enzymes averaged 65.6% inhibition, which reflected severe toxicity. However, these reports suffer from a lack of data from untreated controls. The source for this is Stuart Nunley, In Vitro Enzymatic Inhibition Associated with Asymptomatic Root Canal Treated Teeth, Results from a Sample of 25 Extracted Root Fragments, Journal of Orthomolecular Medicine, 2012. Recent scientific literature has shown that having one or more root canal procedures is associated with an increased incidence of coronary heart disease. A 2013 study examined the blood clots that cause heart attacks or myocardial infarction and found a high concentration of the DNA found in the pathogens most commonly seen in root canal treated teeth, as well as in chronic gum disease. The same types of oral pathogen DNA have also been identified in a majority of ruptured intracranial aneurysm specimens obtained from patients, as well as in a majority of the samples of pericardial fluid surrounding the hearts of chronic coronary artery disease patients. Sources for this are F. Frisk et al., Endodontic Variables and Coronary Heart Disease, Acta Odontologica Scandinavica, 2003. F. Frisk et al., Endodontic Variables and Coronary Heart Disease, Acta Odontologica Scandinavica, 2003. Joshipura K.J. et al., Pulpal Inflammation and Incidence of Coronary Heart Disease, Journal of Endodontics, 2006. And T. Pesci et al., Bacterial Signatures in Thrombus Aspirates of Patients with Myocardial Infarction, Circulation, 2013. M.J. Pisalo et al., The Connection Between Ruptured Cerebral Aneurysms and Odontogenic Bacteria, Journal of Neurology, Neurosurgery, and Psychiatry, 2013. And A.M. Luhalinen et al., Oral Bacterial DNA Findings in Pericardial Fluid, Journal of Oral Microbiology, 2014.